Hi, myself is Shalini Bhardwaj from ITV Networks, Medically Speaking. So today we are going to talk about cancer in children, which is one of the leading cause of death in world, we can say, and amongst adolescents also. So today we have doctor with us, Dr. GAURAV KHARYA from Apollo Hospital. He's a senior consultant, pediatric, hematology, oncology, and immunology. Welcome to Medically Speaking.
Hi, Shalini, how are you?
Yeah, sir, I'm good. Sir, so today we are going to talk about the cancer, basically. So it is, sir, why, what is the common cause, if we talk about cancer in children, what is the common cause behind it?
Yeah, so when we talk about the etiology or the reason or the cause behind the pediatric cancers, it is very different from the adult cancers. Huh? So in adult malignancies, you can very clearly say that okay, this person used to have tobacco and that is why he has developed sort of throat cancer. Huh? This person was alcohol addict and that is why he has developed this particular cancer. But this is not true in pediatric malignancies. So the pediatric malignancies, most of the time, the etiology is sort of not very clear. For example, if we say talk about the most common pediatric malignancy, which is acute leukemia, blood cancers, that is the commonest pediatric malignancy, and there is no clear-cut etiology. Now, this is one thing, but if we look at it scientifically, there are a lot of hypotheses which suggest that what could be the possible reason for increased incidence of cancer. Okay, so one is increased exposure to different kind of chemicals, different kind of radiations. So it has been seen that whenever a country is in that developing phase, a lot of industrialization is happening, and due to that, the kids or the patients get exposed to a number of such agents, and these are the agents which actually predispose for cancers. So it is different in kids as compared to the adults.
So,
apart
sir,
from this,
yeah, please continue.
apart, just a second. Yes, hello. Just a second. आप थोड़ा देर से call कीजिए please. She's not around. Sorry.
Yeah.
Apart from this, what we have seen as pediatric oncologists says that the awareness and the pickup rate is also increasing, and that is why there is such a huge increase in the numbers. Earlier, a number of patients who were diagnosed somewhere in periphery, unfortunately, they were not diagnosed. I would say they were not even suspected, and before a proper diagnosis, a lot of patients used to die. Okay. But nowadays, because of increased awareness amongst the pediatric colleagues, increased awareness amongst the parents, increased diagnostic modalities, wide reach of diagnostic modalities, a lot of patients are now picked up early. And this is another reason why the incidence of pediatric malignancies have increased.
And sir, if we talk about, if somebody, a child has some kind of problem, how to go about it? A general, we say kind of symptoms do they have?
Yeah. So we say that there are some red flag signs and symptoms in pediatric oncology. So the commonest are that, fever is the commonest presentation. Okay, so if a child is running fever, which is not being explained by the seasonal illnesses. So usually the seasonal illnesses, they sort of settle down within a week or 10 days, might need some short course of antibiotics or might settle down on its own. But whenever there is a fever which is sort of sustained and not being explained by the usual factors, then the parents and the doctor should, the primary treating pediatrician should be concerned. Apart from fever, if there are any bleeding manifestations, okay, so over the body, petechial bleeding manifestations, nosebleeds, or bleeding from any side, okay, so that's another red flag sign. Any kind of lumps or bumps over the body, any swelling which is not the usual one. A number of times the kidney tumors, they are picked up while the parents or while the mother is just giving a normal shower to the baby. So while giving the shower, while dressing up the baby, she realizes that there is a swelling inside the tummy. Okay, and that is when they consult a pediatrician, and it is picked up. All right, so these are the usual red flag signs by which pediatric malignancies can be picked up. For brain tumors, which is another common cancers, so any sort of gait abnormalities, visual abnormalities, diplopia, morning headaches, vomitings. Okay, so these are the red flag signs for brain tumors.
So do you think comparative to adolescents, it's very difficult to know about it that a child has cancer?
I would say partly it is right and partly not, because yes, it is difficult because child cannot express. That's a basic problem. But on the other hand, a child, normal child will never be cranky. Okay, so whenever a child is cranky, uncomfortable, that's the first and most important indication that something is not right. Okay, and if we just keep on evaluating and finding the reason for the child being unwell, cranky, not the usual self, most of the time we can pick up the diagnosis. There is in case of adults, they might sort of, because of their threshold, they might suppress their symptoms for quite some time before it becomes sort of unbearable. So these are the differences between adults and pediatrics. So there are some good things which help in early prediction also.
So especially in a country like India, which is a developing country, do we have enough facilities to cure cancer in children?
As far as the facilities are concerned, my one and only statement is that we have the best possible modalities in the world. So best possible treatment modalities, best possible clinical acumen. Okay. So if you look at the outcome of pediatric malignancies in dedicated pediatric oncology setups across the country, okay, right from north to south, east to west, central India, if it's a dedicated pediatric oncology setup, the outcomes of the pediatric cancers is as good as any other European or American center. Okay, the problem what we face is the outreach. Okay, so the patients who are there, unfortunately, in peripheral areas. Okay, so it is difficult to pick them up because the awareness amongst the pediatricians, that is still lacking. Okay, so the pickup rate is not good. Treatment modalities are all there, but we are missing a lot of cancers, pediatric patients which are suffering from pediatric malignancies, and unfortunately, either they present to the pediatric oncology setup very late, or they are never diagnosed. Indian Academy of Pediatrics and the Pediatric Hemato-Oncology chapter, they're working quite actively on this particular thing. And Indian Academy of Pediatrics, in association with Pediatric Hemato-Oncology chapter, they're initiating a very nice and very enthusiastic program which is called as Catch Pediatric Cancer. Okay, and I'm the national convener for that particular program. And the purpose is this only, that to sort of strengthen the pediatrician which are practicing in periphery. So say a person is practicing somewhere in UP, okay,
right,
Agra, or 100 kilometers from Agra, doesn't have a direct access to a pediatric oncologist. Suppose he sees a child with one of the red flag signs as we discussed, so persistence of fever, bleeding manifestations, or some other red flag signs. Even if he sees the patient, he doesn't have access to a pediatric oncologist, and that is where the disconnect lies. Okay, right. So we are trying to build up a system by which we can strengthen the pediatrician, so that whenever he suspects while sitting in his OPD that, okay, this child needs a second consultation from a pediatric oncologist, immediately he can ring a pediatric oncologist, okay, discuss the case, and pediatric oncologist can suggest, okay, do these investigations and come back to us with these investigations. And by this, a number of patients we think we might be able to pick up. So this is very enthusiastic beginning, but let us see where do we reach.
Yeah, that's very important, sir. One data which we have, it says that, high income countries are 80% of children with cancer are cured, and in very shocking, and sad part also, that low middle income countries only cure 20% of children. So what else
Absolutely,
can be done?
absolutely.
Strengthening the system is very important. But sir, if we talk about government hospitals, what more we need to do?
So government hospitals are also, as I said, the treatment modalities, the clinical acumen, that is not a challenge. So even in government hospitals, we have excellent people who are working there, and all the modalities are there. The problem is that in one hand, sort of they are too overworked. So
Hmm.
that is one challenge which they face. So the distribution is a little bit unequal. So the government infrastructure, they have a lot of load and limited manpower. The healthcare providers are relatively less in number. On the other hand, in the private setups, the numbers are a little bit less, and the discrepancy is because of the fee structure. There is no model as of now where any child who's sort of diagnosed with malignancies, he gets a mandatory treatment irrespective whether it's a government setup or a private setup. Okay, so again, this is also part of CPC program. A lot of governmental agencies, NSDL, Virgin, everyone, IIT Mumbai, everyone is a part of this project, and we hope that we will be able to build up a system where first of all we'll identify, and once a child is picked up, it becomes a responsibility of uh, I should say the state, that this child should receive proper treatment, best possible treatment. And with this, I think what you rightly quoted, the discrepancy of 20%, 80 to 100%, which is a
It's a
huge gap.
huge gap. It's a very
A
huge
huge
gap,
gap.
sir.
We intend to fill this gap over a period of 5 to 10 years.
Yeah, and sir, if I talk about if a child who belongs to a poor family, they cannot afford, and child is suffering from take example of a blood cancer. So do we have those schemes to help such people?
Yeah. So Shalini, to be honest, it is like 8 or 9 years I've been practicing after coming back from UK, and never ever the finances have been the primary reason for refusal to treatment. Okay,
Hmm.
if the parents are committed, somehow we have always managed to generate enough resources to treat that particular child. Okay,
Hmm.
it is not one man's job. The hospital is very, very, very receptive. Every hospital, whether it's a private healthcare facility, government, definitely it's not a challenge. Even private healthcare facilities, they are very sensitized towards pediatric cancers. Okay, and whenever we ask for any help, irrespective of the hospital I have worked, I have never faced a challenge that we have received this kind of a response from administration that we can't do enough. Okay, so that is one thing. Secondly, there are a number of government schemes. Okay, I think every state government has a fund allocated of around 3 lakhs to 5 lakhs for
Hmm.
any child who's diagnosed with cancer, which is a big amount. Okay, so to
Hmm.
treat any particular child, it's a decent amount
Hmm.
with routine malignancies. And on top of that, there are a number of NGOs, there are a number of crowdfunding
Hmm.
portals. So, to be honest, funding is never a challenge. It is the confidence and the commitment of the parents which is lacking. Because many a times the parents do reach here, we counsel them, we appropriately, but still we feel that because of one or other reason, the treatment is deferred.
Okay, this is also one of the reasons, sir.
Yeah.
On the occasion
Finances, I
of
don't think it's a challenge. Yeah.
Sir World Cancer Day, the message you wants to give to the parents of of children.
No, my only message to all the parents is that pediatric cancers are very different from adult cancers. Cancer as a word is sort of very depressing and saddening thing. But if we look at the outcomes of pediatric malignancies, there is a stark difference. And I would say that majority of pediatric cancers, if they are picked up early, lifelong survival is more than 80%. Okay. So if we develop a system, if we develop confidence in the parents, in general public, that cancer in kids is very different from adults, it is very much treatable, and simultaneously we do other things which we are trying to build up, a system we are trying to build up, I think we'll be able to treat a number of patients whom we are currently missing. Okay, so as pediatric oncologist, I'm sure, just like my other colleagues who are practicing in different parts of the country, we have just one vision and one mission, that no child should die in dawn of life because of underlying blood cancer or underlying cancer.